Hello, I'm Eliza Cheung, one of the technical advisors from IFRC Centre for Psychosocial Support. During COVID-19, staff and volunteers from the Red Cross and Red Crescent movement have been facing different kinds of stressors. Because of the pandemic, there could be like a rise in the operational needs. There is also a change in the modality of how we serve our clients. During our service or our emergency operations, staff and volunteers may also be worried about their own safety and health. At the personal level, they may also be struggling in handling the changes in their personal life, for example, of the work arrangement. Some of them may need to work from home, and at the same time, they may also need to take care of their children. So actually, they are balancing a lot of different things at the same time. In order to support our staff and volunteers, it would be important to have a structure in place. By means of structure, it is more than mental health and psychosocial support, but also an HR and also volunteer management measures. We should inform our staff and volunteers about the risks and also the needs of the emergency operations. Things that national societies employed to protect our staff and volunteers. For example, the insurance packages or protective measures to ensure the safety. At the same time, team leaders and staff leaders should also be equipped with ways to support our frontline workers. This could mean that we should reinforce the ideas as a helper. It's very important for us to first take care of ourselves before we can help other people, especially during this difficult period of time. When physical volunteer gatherings are not feasible, we may consider moving them online. We may have some volunteer gatherings or some semi-formal discussions with them through some online platforms. We may also show our support through some messagings and also through the phone calls. And it is very important for us to remember appreciating the efforts of our frontline staff and volunteers are utmost important during this difficult period of time. Team leaders may also be more innovative when planning for services during the pandemic. In some situations, it would be impossible or not very good for volunteers to come back to the headquarters to provide their support. In situations like this, we may think of some more innovative ways for volunteers to be able to contribute even when they are staying at home. At the same time, it would be a very good idea to gather the volunteers and staff and to ask for the input into the modalities of services. I'm sure that you can get some wisdom from this devoted group of Red Cross and Red Crescent people.